this is the collateral sulcus. They are creating an indentation. Where? On the lateral ventricle. On the lateral ventricle. So they are called the complete sulcus. Axial sulcus. Around the axis of this sulcus, these visual areas are oriented. Okay. Like in the previous picture, we are seeing this is the lateral sulcus. That is not present since birth. But due to development of the surrounding gyri of the brain, actually ultimately one area was there on the surface and that goes inside. That is nothing but the insular cortex that was present on the surface. Now we can see that insula is hidden in the lateral sulcus. So lateral sulcus is called the secondary sulcus, that is not present. Okay. Achha, what is insula? This is the insula. When we are retracting the lateral sulcus, we can see this is the pyramidal shaped area. This is called the insular cortex. Okay. And if you go more inside, we can reach different structures like extreme capsule, claustrum, external capsule, then the basal ganglia. We can reach basal. What is basal ganglia? Actually, we know there is outer grey and inner white matters. So inside of the brain, what we can see, we can expect white matters. That is the white matter is contributed by the fibers. But within the subcortical grey matters are there. Subcortical, below the cortex. Okay, there are within the there is a metal of, we can say there is a white matter. So within the white matter we can expect some nuclei. They are called the basal nuclei. Say they are the subcortical grey matters like lentiform nucleus, caudate nucleus. Okay, these are there. That will be a different class. So if we go inside, if I put a probe inside, then that will ultimately go up to the level of the basal ganglia, and it will also go up to the internal capsule level. So that is the insular cortex. There are some two gyrus brevia, small gyrus in front, and there are two big gyrus behind. There is one gyrus behind. That is the gyrus longa and gyrus brevia. So we have to, in nutshell, what we have to know? We have to know all the sulci, like central sulcus, precentral sulcus, postcentral sulcus, superior, inferior, frontal sulcus, superior and inferior temporal sulcus, and similarly the different gyri. And this is the occipital cortex, where we can get the lunate sulcus and calcarine sulcus. Here we can see the lateral one is occipitotemporal sulcus, and this is the medial one is the inferior surface. We can get the collateral sulcus. Okay, and medial to that area we can get the area. This area is called the parahippocampal gyrus, where we can get the area 28, which is responsible for olfaction, audition, the temporal lobe we have seen, then vision, occipital lobe, area 17, area 18, area 19. Okay, then area 28 is for olfaction. It's a part of the piriform cortex, part of the limbic system. Okay. So other area we know, that is the frontal eye field, that is the area 8, and others 9, 10, 11 and 12, they are called the prefrontal cortex. They are responsible for personality development, for mental concentration, judgment and everything. Okay, this prefrontal cortex, that is the functional area, it is present within the superior, middle and the anterior part of the superior, middle and inferior frontal gyri. Okay. Now this is the corpus callosum. Already I have shown you that is the part, that is the cranium, club shaped, then body, then this is the Gyri, and this is the rostrum. Okay, okay. Ultimately, we know there is another part which is coming out. This is the fornix, and if you go inside, we have shown you that is the lateral ventricle. Lateral ventricle. I have shown you the third ventricle, and also I have shown you the fourth ventricle. Now, sir will show you the different parts. Again, this is the area 24. I have told you, if you destroy that area, the person will become antisocial behavior. Okay, and area 31 is for pulse and blood pressure. Okay, similarly, these are areas. These are motor cortex. This is the primary motor cortex. Okay, MS1. This is the area 6. This is the secondary motor cortex, and ultimately this is the sensory area. There is a 3, 2, 1. There is a S, capital S. The sensory fibers are more, motor fibers are less. The primary primary motor area, secondary motor area. So like this, and now and this is the paracentral lobule. This is the medial surface where we can see the paracentral lobule. Okay, there is something missing. Actually, this 4 should be given in a should be depicted in another color. That is a motor area, and this is a sensory area. This is present. That paracentral lobule is responsible for perineal reflex, bowel and defecation reflex of other side of the body, and also for the movement of the lower limb of the other side of the body. If the paracentral lobule of this side is activated, then this other side of the lower limb there will be a movement and sensation. Okay, that is being carried out, and ultimately it will reach this there. So now sir will show you the different sulci gyri again to you. Okay,